At Tier Science, our philosophy is that Meibomian Gland Health is foundational to ocular surface health. And this continues to be validated not only at the level of the patient, but also in the ever-expanding volume of peer-reviewed science that continues to show that MGD is not compatible with a healthy ocular surface. And so the technologies that I'm going to review with you today are the LipiScan and the LipiFlow. The LipiScan is technology that is designed for rapid imaging of meibomian gland structure. Using a combination of transillumination IR and surface IR, the LipiScan is able to produce high-resolution, high-quality images of the meibomian gland structure. The LipiScan is both user-friendly to the patient and the technician. It has a small footprint and is specifically designed for the routine imaging of meibomian gland structure in any and all patients without obstructing your workflow. The LipiFlow was designed to treat meibomian gland dysfunction, specifically to treat meibomian gland obstruction. And it was designed intentionally to bypass all of the limitations of conventional therapies for MGD. How do our technologies fit into the dry eye space? Unsurprisingly, the leading cause of dry eye has been shown to be MGD. And what this means for dry eye patients with MGD is that the long-term rehabilitation of the ocular surface of those patients will require the treatment of MGD. Where we now know that the core mechanism of MGD is meibomian gland obstruction, those patients with MGD will require some form of effective treatment for meibomian gland obstruction. We also know at this point that early intervention is best. Early intervention optimizes outcomes. With that in mind, we need technology to enable the routine evaluation of meibomian gland function and structure on all of our patients. In 2011, the Meibomian Gland Workshop recommended that we shift our diagnostic process from the previously accepted criteria in 1990. They recommended very specifically that the diagnosis of MGD be based on abnormalities of meibomian gland function and structure. They went on to say that symptoms and other associated lid margin signs are not required for a diagnosis of MGD. They went on further to say that these symptoms and associated lid margin signs are indicators of later stage disease. We understand now that the core mechanism of meibomian gland dysfunction is obstruction. The MGD workshop were very clear in their recommendations that obstruction be considered even and treated even at the earliest stage of MGD. They specifically stated at stage 1, which is prior to symptoms. This is in alignment with a diagnostic recommendation that the diagnosis of MGD not only be made in later stage disease. They went on further to say that adjunctive therapies should be added for later stage disease as appropriate. The LipiFlow treats obstruction. And how it treats obstruction is heat is applied to the inner lid surface up to a temperature of 42.5 degrees Celsius. And while the inner lid surface is heated to 42.5 degrees, the LipiFlow simultaneously evacuates the gland contents. This treatment is an automated treatment, and all the while the cornea and the eye are protected from heat and pressure. Does it work? Well, the short answer to that question is yes. A longer answer to the question is we now see evidence in the literature for extensive evidence showing that a single 12-minute LipiFlow treatment is highly effective in treating MGD in dry eye patients. There are now over 30 peer-reviewed abstracts and clinical papers showing this effect. Additionally, we now are seeing studies showing the positive effect of LipiFlow in treating MGD in several other patient groups. We see this evidence in refractive patients, cataract patients, contact lens wearers with MGD, and Sjogren's patients with MGD. Patient access and coverage. In 2012, TearScience launched the LipiFlow and the LipiView 1. In 2015, to enhance our access, patient and eye care provider access to our technology, we cut the activator price and the capital equipment price by 50%. In 2016, we launched the LipiScan. And these decisions on our behalf to enhance accessibility of our technology have been highly effective. In 2014, we treated 15,000 eyes with LipiFlow. In 2015, we treated 30,000 eyes with LipiFlow. In 2016, we treated 60,000 eyes with LipiFlow. And we have a very attainable goal to treat 1 million eyes by 2020. So what's in the pipeline? Well, I'm excited to tell you that we, with our lofty goal of treating 1 million eyes by 2020, we've had concern for the waste that our disposable might create. And in so doing, we have now launched the Activator 2, which no longer has a disposable cable. The cable, the semi-permanent cable, now attaches to the convex surface of the eye cup. So what's the future? When I think about the future, I think about who has MGD. And if I just look at the prevalence statistics over the last couple of years, the prevalence data for MGD is extremely high. So at this point, it's almost easier to ask the question, who doesn't have MGD than who does? So we think about dry eye and what this means. Dry eye, almost by definition, is a problem of exposure. The ocular surface becomes exposed, and that is the initial inciting stimulus which triggers the toxic inflammatory cascades and vicious cycles that follow. Rightly so, much of our focus up until this time has been on what to do once those toxic inflammatory cycles ensue. At this point, with everything we know, we can redirect some of that focus to what is causing the exposure to begin with. What this means is we can think beyond dry eye. We're at the point where we understand, if we're in the business of managing ocular surface, the ocular surface health, that we're in the business of managing MGD. So to come full circle, the reason for this is Meibomian Gland Health is foundational to ocular surface health. And thank you so much.